Today we're going to be talking about this healthcare situation. All of a sudden we have a crisis. We're not spending money fast enough. We're not putting our grandkids in debt fast enough. Now we've got another convenient crisis. Granted, we need to do something to help people that are uninsured in this country. I don't want to hear one more time how bad our healthcare system is. America has the best healthcare system in the entire world. People get confused with the healthcare system and the people that have access to a reasonable amount of money they need to pay in order to have healthcare insurance. There's a difference there. So I don't want to hear people saying we have the worst healthcare system in the world. We do not. We have the best doctors. We have the best educational system for these doctors. We have the best hospital system. Problem is implementing it to the point to where people that can't afford a regular insurance policy has access to the best healthcare system in the world. We have several problems here that need to be addressed. We don't need to scrap the whole system and become like our British brothers across the pond. Problem is this, one of many. First of all, everything gets eaten up in litigation. These poor doctors, they go to school all these years, they spend hundreds of thousands of dollars that they have to repay in student loans, go through all their internship, their fellowship, everything, and the next thing you know, they go into practice. It takes them half of their career just to pay off all of these loans. On top of that, they get eaten alive with half of the money that they do make, having to pay for insurance to protect them against all these frivolous lawsuits. Don't get me wrong. You cut off the wrong leg, you're done. Check in at Denny's, they need a night manager. But now they're having to practice defensive medicine on everybody that comes in. You go in there with a sprained ankle now, everybody's got to get a CAT scan. You go in for a $200 problem, now it's a $1,200 problem or a $5,000 problem if you have something more serious. They're having to do every possible test that could in any way cover anything, any type of illness it could possibly be, to rule out what it is instead of going after what it probably is. Keeping themselves from being liable, they have to cover all these bases. So now you go in for a simple problem, you've got a mountain of bills that nobody can afford to pay. Okay? I'm not sure about this putting caps on things. I think that we should have loser pay system with our court system. You're going to have something that's got to go through litigation. If it's a real case, lawyers will still take it on contingency. Okay? So if you approach a law firm that takes these types of slip and fall cases, if it's a legitimate case, no more coffee in the lap and getting millions of dollars for it. All right? If your mother didn't teach you any better than not to put the hot stuff between the legs, you got no business driving a car, much less ordering coffee. All right? Problem is this. These lawyers come along and take cases like that, tie up our court system, and the next thing you know, you get a bunch of deadbeat people that have no idea what's going on in the world, sitting on the jury that are going to award these crazy awards to these people for a case that's not even legitimate. Okay? So, if the loser had to pay, lawyers would still be free to take any case he wanted, but he wouldn't take a case unless he knew it was 99% legitimate. Because if he had to pay in the case that he lost that particular lawsuit, he's not going to gamble on something unless it's legit. That right there would cut down 99% of these lawsuits. You're still leaving yourself room for the people that have a legitimate complaint. All right? Second of all, I hear about competition. This competition with the government having their health care policy is going to be competition for the insurance companies and therefore drive down the price. Well, didn't we do that with flood insurance? Remember when all this was going on and now the government is in the flood insurance business and now they're the only one that you can buy it from because nobody else can afford to compete with somebody that doesn't have to make a profit. There is no competition when you've got the never-ending government tit over here squirting out that government milk and they don't have to make a profit on it. How is the guy next to him going to compete with that when he has to answer to his board, he has to answer to all his shareholders, and he's got to make a profit. He's got to make sure it's black above that bottom line. None of this red business. Well, the government can keep throwing good money after bad till the end of time because it's my money. It's your money. They don't know what it's like to have to meet payrolls and have to answer to the board members, okay? So, we opened up. There's 1,300 companies in the United States that has insurance that can encompass this whole problem, okay? Open it up. Most states you can only get 3 to 5 different companies to choose from when it comes to big corporate plans and things of that nature. We open it up now across state lines where everybody can do that. You talk about competition, 1,300 versus 5, that's competition, not the government tit where you got to compete against somebody that doesn't have to make a profit. That's not competition. That's socialism in the works, driving out the competition and getting everybody to where they have to go to the government, just like they did with flood insurance. Now try to go out and buy a private policy on flood insurance. You're not. You got to go to the government, okay? Now, when we start taking these types of approaches, we already have a Medicaid and a Medicare system that's already set up and has been going on for years. Poorly managed because it is government run, and all kinds of fraud and waste, over $100 billion in a year's time in the Medicaid frauds. So we need to start clamping down. We don't scrap the whole system. We have a problem in getting people access to health care that they can afford. Not that it ain't out there, not that it isn't available, it's not available at the current prices. Okay? So, yes, we need to pass it so that people can have access if they have a pre-existing condition. But not that day, otherwise everybody would wait till they got sick and then go down and sign up. Doesn't take a scientist to figure that out, all right? But you got to have stipulations in there. Yes, 6 months for this, 6 months for that, what have you. You can more easily hold on to the insurance that you had in the case of the demise of the corporation that you're working for. And in the meantime, when you're looking for other work, what have you, all right? We don't want people sitting around forever with no insurance. These inflated numbers that they give us on the people that are not insured at the moment, we know what the true numbers are. This is all going in the direction, if this guy gets his way, he wants us to become England, and he wants us to become France, and he wants us to become like Canada. And those people there, let me tell you something. People in Canada are praying that we don't pass national health care in this country, because where would they get their health care from now? Anybody that's got anything bad wrong with them up there to the north, they're coming down south the border into the United States if they can afford it. This is where they can get care. It's going to take them 2 years to get that hangnail checked out. And heaven forbid if they have something serious. It takes 6 months for a pap smear, 6 months for a prostate. Anything that would be a minor procedure, if caught in time, would be nothing more than an inconvenience in our lives. Those people die from 25% higher rates, okay? I'm not willing to take that chance. We do need to see to it that the regulations are enforced. We open up the competition, let the market work, and see to it that these lawyers are held accountable whenever they do take these cases in not in a frivolous fashion. Okay? If loser pays was implemented, because I don't want to put caps on things like some people are talking about. Who am I to tell you what your life is worth? Who am I to say that your inability to walk now is only worth X number of dollars? No. I think everybody should have their day in court. But if you have a legitimate case, let everybody hear it. If not, if you just want a little coffee in the lap and hit the bank running, no. That's what's going to do away with all of that. I have much more to say on this. I appreciate your time and your attention. See ya.